Now, the Therapeutic Goods Administration will move to ban compounding pharmacists from making their own versions of injectable weight loss drugs like Ozempic. The drugs are approved for diabetes but are widely used for weight loss, leading to supply problems and shortages in Australia. For more on this, I'm joined by the President of the Royal Australian College of General Practitioners, Dr Nicole Higgins from Brisbane. Nicole, good morning to you.
Good morning, Michael.
What concerns do you have about this?
Well, the TGA set rules to keep our medicines safe. The problem is there's a loophole, and compounded Ozempic, instead of being just used for individuals now, is being manufactured large scale, and it sits all outside of our regulatory frameworks.
How often is this happening? From what the TGA says, what doctors have been able to discover?
So it's increasingly happening, and it's being promoted. I don't know if you've been on TikTok or social media. There's a lot of promotion, and it's big business, and there is that demand. However, we need to look at quality and safety and make sure that these medications are in line with what Australians expect for all their medicines.
What are the potential dangers to patients from compounding?
Yeah, so look, compounding's great, and it's used there for individual medications and small amounts. But we're talking large-scale commercial that sits outside, and so the risks are around contamination with bacterial or fungal infections, about looking at the pipeline and the supply and the delivery of these medicines when they reach people's homes. So the other bit is it sits outside. We don't know if there's problems because there's no requirements around reporting.
So the TGA is moving to ban compounding. I guess is the worry now that given the popularity of these drugs, the compounding may move to the black market off-site.
Yeah, you're right, there is a huge demand, but we need to make sure that we have these medicines for the people who it's designed for and who need it the most, which is our type 2 diabetics. At the moment, there is a global supply shortage, and the compounding, as I said, it's there for individuals, but it's not there for wide-scale, big business manufacturing, that has been occurring outside of our regulatory frameworks.
It's been used in a widespread way for weight loss, for very much cosmetic reasons. What do you say to those patients who are trying to get hold of Ozempic for those reasons? They're not diabetics, they're not who the drug was designed for. What do you say to those people?
Look, this is going to be challenging, and we know that it can be really effective for some people, but it's a tool in the toolbox. So it's part of a wider strategy. Have a chat with your GP, and it's not just about Ozempic. It's looking at the psychological, the exercise, our dietary needs. So it's complex, and there are other options, and this is really important, though, to keep our medicines safe within Australia.